6-week series on the role of the DSP in supporting those with intellectual and developmental disabilities and mental health conditions. Today's learning objectives presented on the screen. We would like you all to be able to identify client and provider rights and responsibilities, be able to describe differences between support and guidance and supervision and management of clients, to define dual diagnosis and describe common co-occurring mental health conditions and diagnoses, describe expectations, tasks, and duties in supporting mental health referral and treatment, and to describe where to find information about client conditions and diagnoses, such as in the OISP and national, state, local resources for support. At this time, I invite Devin to share her screen and provide our introductory session.
Thank you, Andrew. So as Andrew said, I am Devin Conklin. I'm a clinical behavior specialist with Nisonger, and I'm very excited to be presenting with you guys today. We can skip the learning objectives because Andrew just went over them. So I wanted to start this presentation discussing client rights, because I think one of the biggest challenges that we see as clinical behavior specialists in doing trainings with DSPs is this balance of we're supporting an individual, but we also need to understand and respect their rights. So you can find a full list of client rights at the link I've provided here, but I wanted to highlight a couple of the ones that I think are really important and come up a lot in conversations with DSPs. So individuals with intellectual and developmental disabilities have the right to be treated with respect. They have the right to safe housing, right to communicate and have social opportunities with either sex, right to food, right to privacy, and right to medical care and confidentiality. And why I think this is important is because we need to remember that people with IDD have the same rights as you and I. And sometimes it's that balance of they have the right to make a poor decision. They have the right to healthy foods such as fruits and vegetables, but they also have the right to ice cream and cheeseburgers and pizza. And so really thinking about that question of if anyone in my life stops me from making these choices, and if the answer is no, then I need to allow the individual I'm supporting to make that same choice, right? We have to offer them that opportunity because it is their right. However, I realize that puts DSPs in a really difficult position. And that's one of the first things I say when I'm doing trainings is that I think DSPs have the most difficult and the most important job in this entire system. And so direct support professionals do have the responsibility of supporting somebody while maintaining those personal rights. And it can be a difficult balance, but if we are looking at it from what is the role of the DSP is to help people with activities of daily living. So this may look like helping with cleaning and cooking and grocery shopping and hygiene, may look like transportation to appointments, activities, and other things the person wants to do. But it's also providing that emotional support and companionship, and then that guidance and that support and suggestions. And that's the piece where we can respect people's rights, the right to have relationships, to have opportunities to work, the choice over what they eat and how they dress. But we are there too to provide that guidance and that support. So if somebody wants to eat ice cream, but we know that they're also trying to lose weight, we can say things like, hey, ice cream's delicious. I know that you really want to eat that. I also know you really want to lose some weight. What if we tried some yogurt and some fruit right now? And the person may say, yeah, that sounds good. Let's try it. Or they may say, nah, I really want the ice cream. And as the DSP, it's us respecting, okay, they are allowed to make that decision, but we're going to continue to offer that education and that support. So what a DSP is not the boss of an individual. And I think it is a hard balance for DSPs. We're asking you a lot. We're asking you to make sure a person is, dressed and they're at appointments on time, that they're at their job, that they eat healthy because they want to lose weight, but don't be bossy in the way you say it. And a lot of times, individuals that I work with do say, I feel like staff boss me around. And that's kind of the the position that we're putting you in. So making sure that we're building that relationship with individuals that we're working with so that it doesn't support. These are not replacement for friends and family. There are times that friends and family may become a DSP, and that is wonderful if people have that support in their life. But we do want to make sure that if we're not our friend and family, we're maintaining those professional boundaries. That's just important. It becomes very confusing for individuals if we're kind of blurring that work boundary with them. It's important to be friendly, trust. We don't want to overshare about our personal lives with the individuals that we're working with. DSPs are not financially responsible for their individual. I know that we come into this profession because we want to help, but again, maintaining that professional boundary, it's not the DSP's responsibility to pay for somebody's food, clothing, those types of things. And we get that question sometimes, do I have to buy this person something? And it's okay to say, no, that's just not part of my job. And then DSPs are not a babysitter. So I hear this sometimes, both individuals that are being supported sometimes say, I feel like I'm being babysat. Sometimes I'll have DSPs say, I feel like a babysitter. So DSPs are not just there to sit and watch a person. They're there to interact and so to support the person. So I wanted to talk about what is support. We hear these words a lot, support and supervision, and they are both important and are both needed, but they are also very different. So supervision is outlined in somebody's OISP. It'll be very specific on what type of actual supervision do they need? How do we observe this person? Do we have to watch them constantly? Do we always need to be able to see what they're doing? Or are they able to be in their room and we just can hear them and we check on them every hour? Do we need to be within a certain distance of them? If we're out in the community for safety, do I have to be within arm's reach? So there's different types of supervision. Make sure that we're checking that OISP to know, how do I need to support this person? Where I should have said supervise. Support looks very different. This is us listening to somebody when they're talking. It's talking together, having a conversation, problem solving together, listening to their point of view and having that back and forth. We're offering help, we're offering suggestions, we're offering education, we're teaching somebody new skills. We're helping the person grow and reach their goals, and we're being supportive in doing that. I give the example, it's a lot different to sit and watch somebody do a puzzle versus sitting and doing the puzzle together. So that for me is the difference between supervision and support, right? I need to physically, watch this person, but I can support them in what they're doing by being involved and active. So this ECHO session is really focusing on mental health and how we support individuals who have what we call dual diagnosis. So this is when an individual has an intellectual or developmental disability and a co-occurring mental health diagnosis or diagnoses. So about 35% of people with IDD also have a co-occurring mental health diagnosis. And sometimes what we see is some of the symptoms of mental health are kind of overlooked because somebody has an intellectual or developmental disability. So I wanted to kind of separate these two things first. An intellectual and developmental disability can look like challenges or different ways of presenting social skills, life skills, learning, communication, and sometimes it can impact mobility. Whereas mental health is changes in mood, behavior, thought processes, and relationships. And so as a DSP, one of the things that can be helpful is you really know your individuals, right? You know the people that you're working with, and you can say, hey, yes, this person does have an intellectual disability, but I'm noticing that their mood is really different than it used to be, or their behavior has really changed. And that's where, DSPs can be really helpful in guiding the help and the treatment that somebody is receiving, or just to help support them in, whether it's the home or the day program. Oh, not going on. Nice. There we go. Okay. I wanted to talk about a couple common mental health conditions that come up a lot in the individuals that I support. And I think they're some of the ones that are probably more common and more well known. There are obviously many more mental health diagnoses, and we're going to talk about where to find some resources on that later. The first here is anxiety, and this is defined as a group of conditions related to lasting feelings of dread and uneasiness. It can cause restlessness, irritability, and difficulty focusing. So sometimes we may see these same, characteristics in somebody who has IDD, but when this is happening, every day, this person is really having a hard time with focusing, and they're really restless, and they're, it's difficult for them to stop thinking about something once they've started, and they're really worried about it. This is when we start to think, okay, this is maybe something bigger. This is anxiety, and this person may need some help with this. Depression is a group of conditions related to lasting feelings of sadness, hopelessness, guilt, lack of energy, and loss of interest in daily activities. This may cause tiredness, irritability, and changes in eating habits. So if you're supporting somebody and they used to really enjoy going out with their friends and family, and lately they don't really have any interest in doing that, we're noticing that they just kind of seem a little bit sadder. They don't have as much energy as they used to. This is something we want to communicate, and we want to talk to their healthcare providers about, because it could be depression. This is and we want to get them treatment for that. Attention deficit or attention deficit hyperactivity disorder is an ongoing pattern of behavior, such as inability to focus, hyperactivity, and impulsivity that impacts a person's ability to function and develop. You may see things like trouble staying organized, constantly moving around, or kind of acting without thinking. Again, I think some of these things you may see with somebody with IDD, but this is when, again, it's becoming it's overwhelming for the person, and it's really hard for them to focus and stay organized and stay on task. And it's impacting their life and their ability to do the things they want to do. Bipolar is a mood disorder that causes shifts in a person's energy and activity levels, concentration, and ability to complete tasks. These shifts are different than the normal ups and downs that we all have, right? We all have difficulties in our days. We all have different moods based on things that are going on in our lives. But this is a more prolonged period of depression and then mania, where we see somebody, that maybe has a lot of energy. They're not sleeping. They're having, racing thoughts. So it's this pattern between those two different moods. This is not all happening in one day. It's going to be a couple of days or weeks of depression, followed by, days or weeks of mania. So we thought it was important to kind of highlight some of those common conditions that you may see with the individuals you're supporting, and then talking about, okay, now what do we do as a DSP to support this person? So one of the most important things that a DSP can do is report changes in mood and behavior. DSPs are really the expert on the individual they're working with, right? You're the one seeing them day in and day out. You're going to know if their moods are changing than how they used to be, if their behavior is different, if they used to be very active and now they're sleeping all the time. That's information that we want to share with maybe it is sharing it with a house manager or a program coordinator, or if you're the one taking them to an appointment, you can help share that information to the medical provider. Sometimes our individuals, are great and able to, express their thoughts, feelings, emotions, what's been going on for them. And sometimes they're not able to do all of that. Or sometimes you may need to add a few details. So someone may come to an appointment and just say, I'm sad. And that to a provider could look like, oh, they're just sad today. Whereas you could share, hey, they've been feeling sad for a couple of weeks. This isn't how they normally are. Can we look into that a little bit more? We always want to make sure that we're asking the individual before we just share information. So saying, is it okay if I tell the doctor a little bit more about that? Would you mind if I shared about this thing that happened? And reminding them that it's not to, get them in trouble or to make them feel bad. It's to help them to get the care that they need. It can be important for DSPs to learn some of the coping skills that their individuals utilize. This way we can help individuals practice them. We can help remind the individual of these coping skills when they're upset. And we can help the person use those skills and be able to calm or cope with a stressful situation. We can share information about patterns of behavior or any changes that happen in a person's life. So sometimes it might be something huge, like they lost their job, or there was a death in the family, or sometimes it might feel like it's not a big change to us, like, hey, they got some new staff people, but for somebody that may be huge. It may have been the loss of a staff person they really enjoyed, or now it's all new people in their home. So we want to make sure that we're sharing that information too, because all of those changes can impact somebody's mental health. It's important to learn what makes the people that we're working with feel safe. So if I'm, really anxious and my DSP knows that listening to music is going to help me feel safe, that can help the person feel, calm down, feel safe, so that they're able then to talk through a situation with their DSPs. So everybody's going to find different things comforting, and so learning what makes your individual feel safe is really important. Routine is important to everybody. Knowing what to expect in your day and having some consistency is really important. So we should learn the routines that our individuals like and how they want their day to go. That's really important then for us to help maintain those routines and communicate when things are going to be different, so that people can anticipate that and think about those changes. It's important that we're giving medications as directed. So making sure that people are receiving their medications on time, they're receiving them daily, and that if they're not, if they're declining their medications, that we're reporting that to somebody, that we're making sure we're telling a manager, or we're telling the doctor when we're assisting with those appointments, because that information is also very important. And then getting to appointments. So a lot of times DSPs are going to be responsible for driving people to their appointments, but this also looks like making sure that we're providing a lot of time for somebody to get ready and get out the door, that we're making sure we're taking, maybe we need to take behavior data with us, or we need to take a list of medications with us, that we have told the person about this appointment. We're not waiting until the last minute. And so that also means, that managers are communicating with DSPs about appointments. DSPs are aware of when those are happening. They know where they're going. That helps everybody feel better. If we're rushing out the door and the DSP is worried about where to go and they don't have directions, that can set off the appointment to feel, very anxious, rather than if we have a plan and we're ready to go, it can help the appointment go smoothly. Next, I wanted to focus on the OISP. This can be an overwhelming document. It's very large and there's a lot of important information in there. So I wanted to highlight some areas that you guys can find that important information about the individuals you're supporting. So the important 2 and 4 sections are a great place to look to find the information about, what is important to this person to feel supported? What does this person need, to feel happy and safe and supported by their staff? And then how do we actually do that? As the DSP, what do I need to do to help that person? So if it's really important to my individual that they spend time with their friends, and they really like to get together with their friends at least once a week, but it's important for them that I help them make those plans. So I'm going to need to sit next to her while she calls her friend, and I'm going to help her look at her calendar and find a time that works for her. So that's where what's important to the person, and then what can I as the DSP do to help, make that happen for the person. The known and likely risks is where we can find, could be behavioral risks, it could be, health and safety risks, but this is where we're going to find that supervision information. So does the person have eyes on supervision, or can they be somewhere and I just need to hear what they're doing and I check on them every so often? And then what am I as the DSP supposed to do if this risk occurs? So if somebody is, at risk of falls, what do I need to do? Do I need to offer them a hand when we're, stepping down off the curb? It again is going to outline exactly what is the DSP supposed to do in these specific situations. And then diagnoses may be listed in the assessment section of the ISP under the healthy living title. There is a box about medical and dental. However, not all OISPs are listing somebody's full list of diagnoses. So also check on the MAR. If you're giving a medication, there's supposed to be a diagnosis listed under that medication, along with the doctor that's prescribing the medicine. So look there, and that can give you some information if you'd like to educate yourself further and say, hey, I see this person's taking medication for anxiety. I'm going to look up, the symptoms of that, so I know how I can help this person, or things I can report to the doctor when I'm providing that support during an appointment. There are lots of great places to find resources on role of the DSP, and then also mental health diagnoses, treatments, and medications. The National Institute of Health, the National Alliance on Mental Illness, and the Ohio Department of Mental Health and Addiction Services have great pages that give some really clear and simple information about different mental health diagnoses, the symptoms that you may see, causes of these diagnoses, and then common treatments. So that can be really helpful if you do become aware of somebody's diagnosis, looking here, or if you're supporting somebody and you're like, things are changing and I'm not really sure what's going on with this person, but I think it could be this. You could, look up some information and educate yourself on some common mental health symptoms. And there's my references for this. So Andrew, I'll turn it back over.
Thanks, Devin. That was a great introduction to our series. I'd like to open it up to our participants to see if there are any questions for Devin or any points of emphasis that you would like to echo on this first presentation. I see Anne has her hand raised. Anne? I'm sorry, Anne, can you unmute yourself, please?
Sorry about that. Thank you. Good afternoon, everyone. I'm Ann Weissent with the Ohio Department of Developmental Disabilities. Thank you guys for putting on this series, and we're so excited to be part of it. I just wanted to make a comment that goes along with some of what Devin spoke about in her introduction, and that is just emphasizing how important the role of the direct support professional is, especially in sharing your voice with team members, talking about, observations when you're going to a doctor's appointment and making sure that, that is getting conveyed back to other medical professionals, other members of the team, your staff, your management and frontline supervisory staff within your organization. And so, I just want to emphasize again, for those of you who are direct support professionals working within organizations, just finding out how you can share the things that you learn about the people that you support, because as small or as trivial as it may seem, if it is something new, unusual, or a change for the person, it could impact many of their services. So making sure you know how to share that information, get that information to people who can get it to the team, get it to leadership within your organization. If you're working in an ICF, to your Qs and your ICFs, it's so very important. And the role that you play in sharing those observations certainly have a tremendous impact on ensuring that the service plan is written in a way that allows individuals to live their best lives. So thank you.
Thank you, Anna. It's such a great point to emphasize, and an effective plug for next week's session, which will focus on team communication and its importance working together. If you have other questions, I'm going to pause momentarily to see if we have any other questions. You can also type those into the chat as we move forward for Devin or other team members to respond to. Jim, I see that you've unmuted. Did you have a question? While we're waiting for that, maybe just one more question to attend to while others are thinking. Devin, I think it was an important point how you recognized that there is just such a strong overlap between challenges or issues that might present with an intellectual or developmental disability, and knowing how to recognize or differentiate where that blurs into a mental health condition. Any kind of finalizing thoughts on that, or strategies for those of us that aren't mental health providers or specialists in the field, to recognize how to distinguish that blurred condition and when to take action effectively?
Absolutely. And I think that's a question, as a clinical behavior specialist, I get a lot from DSPs, because I'm talking about people's behavior and they'll say, is this just kind of who they are, or is this, a mental health symptom? And I think part of it goes back to what Anne was just saying about, really advocating for your individual. And if you know this isn't how they always are, this is different, their behavior or their mood is different than how it was before. We want to really make sure that we're expressing that to mental health providers or physicians, so that they're starting to ask those questions and for themselves and think about other diagnoses. I find a lot that DSPs provide really great information about, this isn't just that they, get upset this one single time. It's, they have these anxieties often, or these worries often, maybe is how it would be phrased. And then that can be looked at as, an anxiety disorder. So it's really advocating for the things that you're seeing with the individuals you're supporting. As a clinical behavior specialist, I love data, and so we always go back to the data on people's behaviors or their moods. Bringing in incident reports, all of those things can be really helpful to share with providers that this is not just because they have an intellectual disability. This is something else that we think is going on. Can we please explore this?
Great. Thanks again, Devin, for your bravery in providing our first presentation for this series. Very well done. Continue to encourage our participants to also, feel brave and courageous in this community of practice. I think, collectively, we are all here for the same goals and aims. So as questions arise, or you have points of emphasis that you think are really important to echo to the team, please feel free to raise your hand or unmute yourself and chime in.